guys, in this video today, I really want to talk to you about the truth about the coronavirus, some updates that we came to, some updates that we know now that we didn't know in my last video, and what you should be aware about currently when it comes to the coronavirus. So for those guys who are joining for the first time, my name is Dr. Samir Islam, and yes, I'm an actual poop doctor, but not only that, I'm actually a medical doctor as well. I'm a board certified internist, and my passion is to give you tips and tricks to help out with your health. If you're new to this channel, don't forget to smash that like button so you can get more information, especially like topics I'm talking about today, which are updates on the coronavirus. So last week I did a video on the coronavirus about what we knew at that point in time, but since then we've had recent new developments on the coronavirus. My message throughout this video is for you to be alert but calm, because it's important for you to have the information, but use that information to understand what is going on. I have seen a lot of things either on Facebook, Instagram, social media, the news, really hyping up some of the concerns about the coronavirus, which has led a lot of my patients to be extremely concerned and scared of what could be going on, and there's a lot of misinformation out there. I want to give you guys the truth on what we know currently about the coronavirus. So I'm going to stress some numbers. These numbers are from February 11th, 2020, so this information may change in the next couple of days or the next couple of weeks. Currently, more than 43,000 people have been infected with this coronavirus, the novel coronavirus as the name is now called. There have been more than 1,000 deaths worldwide, but the vast majority of those deaths are in China. So far, as of today, there's only been 12 cases in the United States. In the whole entire United States, with all the population that we have, there's only been 12 reported cases. And most importantly, there have been no deaths from anybody here in the United States from the coronavirus. Once again, I really want to stress, I want you guys to be alert but calm. Even though this seems to be a very significant disease, which it is. Currently in the United States, only 12 people have been infected and no one has died from this virus. So what exactly is a coronavirus? So a coronavirus is a type of virus. It's been around for quite some time. You may have heard about the coronavirus back when we had the SARS epidemic and then the MERS epidemic as well. Those epidemics were from the coronavirus. Now, a virus is a particular entity that can get into your respiratory tract, maybe even your GI system, to cause a lot of symptoms to occur. And the difficult thing about a virus is that we can't treat that. We can't give you antibiotics like we would for a bacteria infection. We can't really use treatment besides mainly supportive care, treating the symptoms that come from a virus. Now, most people have been infected with a type of virus, maybe the common cold or even the flu, but the coronavirus is typically a virus that's been found in animals, except for in cases when it's jumped to humans. The most recent case being the novel coronavirus, but the other cases being the MERS virus and the SARS virus. There are 7 strands of the coronavirus that can become infectious, and the vast majority of people will get a typical coronavirus. They may have the mild cold. But what's different about this new virus, and we're still looking into the research behind this, is that it causes a lot of upper respiratory tract symptoms that can lead to a lot of complications from that. Currently, we think it's spread via 2 ways. One is the respiratory tract, so whenever you cough or you sneeze, so whenever somebody who is infected coughs and sneezes, those droplets can get into somebody else and they can become infected from that. There have been reports of what's called a fecal-oral spread, where it can be spread from the feces as well, though we're still not quite sure about that. And there have been some cases when the possibility of that virus staying on the surface of some sort of substance, maybe a bed or a chair, can possibly infect people. But the vast majority of people are infected via the respiratory route, either from coughing or from sneezing. You may have seen these terms, especially from the WHO, calling this a global health crisis, or from the CDC calling this a national health emergency. And this may have rung a couple of warning bells inside you. Maybe wondering, what is going on? Should I be worried? Is this something that's very different than what we had before? So number one, it is different, but what this does, this is mainly a term to help mobilize resources. Whenever we can declare something an emergency, this allows clinics to communicate more effectively without barriers that are there. It helps to unlock money to allow more research to be diverted to trying to diagnose this particular virus and also treat the virus as well and come up with a vaccine. This forces countries to become more accountable to the WHO to report numbers, stats, and what is going on with the virus in that particular country. But nationally, this allows more precautions and steps to be taken here in the United States to protect our citizens. This includes things like screening people from China or from the Wuhan province for this particular virus, possibly quarantine those that may be infected, decrease the number of flights from China, and also accelerating diagnostic testing for this virus. Currently, the only way we can diagnose somebody with the novel coronavirus is to send that specimen to Atlanta to the CDC. Obviously, that is cumbersome. It takes some time to do that. And by the time we get our results, the patients may already be infected and could possibly affect other people. With the declaration of this being a national health emergency, this allows funds to go directly to finding out how we can diagnose our patients better, but more importantly, develop a vaccine or a treatment plan for the novel coronavirus. Once again, this is important because I want you guys to be alert but calm. Now, as the virus spread, it's going to spread to countries that are around China or the Wuhan province. And those countries, whether it's East Asia, whether it's South Asia, maybe it's some parts of Far East as well, those countries may be in a lower socioeconomic status and have lesser health care than what we're used to here in the United States. And because of that, you may see a lot more patients pass away from the virus. The main reason that could be the case is that a lot of these patients who get infected need a hospitalization, or some of them may even need intensive care unit. If you're living in a remote area in those countries, you may not have easy access to healthcare, and the healthcare that you may have access to may not be the top of the line. They may not have all the equipment that we have here in the United States. They may not have all the medicines that we can give to our patients as well. And so you may see more and more people unfortunately passing away from this virus. So what are some facts that we know so far? Number one is that we do know it is a respiratory type of virus. It causes respiratory type symptoms, the main symptoms being fevers, cough, and shortness of breath. But keep in mind though, 10% of the patients so far infected have no respiratory tract infections. They may just present with GI symptoms, maybe some nausea and some vomiting. But the vast majority of people present with some sort of upper respiratory tract infection. Now, these symptoms are very non-specific. A lot of people can have shortness of breath, cough, congestion. They can have that from the common cold, maybe from allergies, maybe bronchitis, or maybe even the flu as well. Keep that in mind. And so now when you take these symptoms from somebody who recently came from China, that combination may raise a red flag for your healthcare provider to test you for the novel coronavirus. Some of the new things that we know right now, so there was a report of what's called asymptomatic spread, meaning people may have had the coronavirus, may not have had any symptoms, but still spread the virus. We know that is currently not true. Those patients that were reported to have asymptomatic spread actually did have mild symptoms. So currently, as of this point in time, we have no evidence of what's called asymptomatic spread, meaning having the virus, not having symptoms, but still spreading it. The vast majority of people who have the virus that are contagious have symptoms: cough, shortness of breath, and fever. Number three is that we know that face masks don't seem to help. So those face masks that you may be seeing on TV, on social media, of people trying to protect themselves, it actually does not help out trying to stop the spread of the coronavirus. What these face masks do is that they protect the person who's wearing it from causing someone else to be contagious from what they have. I'll put a link on the video right here on my review on these face masks. So for example, if I am sick, let's say I have a cold, I have the flu, I will wear the face masks so that I don't infect you. Now me as a doctor, I will wear a face mask in the hospital when I'm around very, very sick patients, patients who have a compromised immune system, maybe they have cancer and they're on chemotherapy, and I wear that so I can protect my patients from whatever I may have. But so far we know that the face masks don't make any difference from preventing the spread of the coronavirus. And the reason I mentioned this is that currently there is a medical shortage of face masks. This can be a very significant problem because we need these face masks in the hospital setting to protect our patients and to make sure that we can give the best quality care. If there are not enough face masks out there for us to use as healthcare providers, this can cause a significant problem whenever we're dealing with our sickest patients. And then lastly, We do have vaccines that are being developed. More than a dozen vaccines are being developed to try and see if we can find some way to prevent the spread of this virus. So work is being done. Now this whole time I want you to be alert and calm, and I want to throw some stats at you. What if I told you there was a virus in which 19 million people were infected? This led to over 180,000 hospitalizations, and from this virus, 10,000 people died. If I told you there was this virus that did that, this would probably freak you out. It does me. Well, guess what? That virus is here. That is the actual flu virus. So we currently have the flu. It is affecting the United States, and these are the stats from the flu. So if you have not had your flu shot, guys, please get this. We know that it helps, and we know that it can prevent the complications if you get the flu. But when you compare the stats of 12 people infected with the novel coronavirus, with 0 deaths in the United States, but with 10,000 deaths from the flu, we really have to keep things in perspective. Once again, be alert, but be calm. So how can you protect yourself if you're worried from the coronavirus? So number 1, don't travel to China. Number 2, you really got to wash your hands. This has been the only thing that's been shown to help prevent the spread of the virus. Speak to your healthcare provider if you're worried about whether you have the coronavirus, or you may be exposed from somebody who had it, or you recently went to China and you're having these symptoms. Make sure you speak to your healthcare provider. But it's very important that you do this soon, because your doctor may need to make changes to help address some of the concerns when it comes to causing other people to be contagious from this virus. They may need to see you after hours when there's no one in the waiting room. They may need special equipment to make sure that they can keep you safe and keep other people safe as well. Avoid touching your nose, your mouth, and your eyes when you have unclean or unwashed hands. That's one way you can spread a virus. If you're coughing or you're sneezing, use a tissue to cover your mouth and throw that tissue in the trash. And then lastly, listen to high quality people who know what they're talking about. Watch my videos. Follow people who know what they're talking about. Don't jump on social media. Don't jump on Instagram. Don't follow an influencer when it comes to getting knowledge about the novel coronavirus. I will give you information that you need, and I'll answer any questions you guys may have about the coronavirus. I want to thank you guys for watching this video. If you have questions about the coronavirus, please comment down below and let me know. I may do another video update in the next couple of days or weeks, depending on what more information that we need or what questions you guys have. But guys, stay happy, stay healthy, stay alert, but be calm. Thanks and take care. Hey, if you want more information about the coronavirus, click on these videos over here.